Well, for me, I live with HIV every day, so an HIV-free Oregon is a future event. I expect to have HIV till I die, but if it were possible that I didn't have it, it would mean a lot of money I didn't have to spend on medication. It would mean a lot of time I didn't have to go to the doctor regularly. It would mean a lot more people who I didn't have to worry about whether there would be stigma or not. So we're really talking about stigma-free, less medication, less medical attention, and all of that would be really good stuff.
My name is Robert Noche, and my thoughts on Oregon without HIV. Our state will be without stigma, without shame, without despair, without the fear of giving blood. Our state will be filled with hope again. Fulfilling lives, and regret will turn to cherishing little things in life.
What an HIV-free Oregon, HIV Oregon means to me is vaccinations for the new people, so there's no more newly diagnosed HIV cases. And the future generation of people that are, or the current generation of people that are HIV positive will live on to live their meaningful lives the best that they can.
And I am a long-term survivor of 36 years of living with HIV, which means it's been over half my adult life. It's hard for me to say what it would be like. I would just like to see a generation grow up without having to go through what I had to go through. From my early 20s till now, I live with this. No one should have to live with this. And all of its side effects.
An HIV-free Oregon means that we accomplish creating a state where everybody has equitable access to education, the health care that they need, housing for their family, and access to transportation and healthy food. We need to create a state that is free of racism, discrimination against people, and including who people choose to love. I believe we will get there together, and HIV-free Oregon is within our reach.
And what an HIV-free Oregon looks like to me is everyone with access to healthcare and excellent doctor-patient relationships, an informed and educated community around health and healthcare issues of all kinds, allowing individuals and community members to overcome internal and external stigma. Men and women using PrEP and all forms of harm reduction approach and methods of prevention. Addressing medical and mental health, as well as dual diagnosis issues. Just healthy men, women, children, fathers, mothers, sons and daughters. Healthy families, healthy communities. That is what an HIV-free Oregon looks like to me.
HIV-free Oregon means that people do not perceive those with HIV, AIDS, STIs, etc. as being less than anybody else. That everyone has a legal access to all treatment services that are given to those with HIV, AIDS, STIs, etc. So I think that in that particular world, which is coming pretty soon, the stigmatization that's attached to STIs and HIV and AIDS and so on will be diminished, and we will live in a very happy and unified society, which is what we all are entitled to.
I've worked in HIV prevention and care programs for the past 18 years, and I'm very proud of the work that we're doing right now together to end new HIV infections in Oregon. We have new tools and the expertise, and as a community we've come together to develop a plan of action. Ending new HIV infections means that all Oregonians will know their HIV status, that prevention is working, and that all persons are benefiting equally from HIV medical care and treatment. I want to thank all of the community members from around the state that took the time to develop Oregon's first statewide integrated HIV care and prevention plan. The direction has been set to end new HIV infections in Oregon, and we believe that the time to act is right now.
An HIV-free Oregon is built on the resiliencies of our communities. I feel like we need to work together as a community to find more advanced treatments to not only treat those living with HIV so that they no longer have the virus circulating in the body, but also to vaccinate to prevent new infections. I think that we need to build a community based off of equity and making sure that people have the same access and opportunity to be successful and to support themselves in making healthy choices the first choice in their lives.
Wow, what that means is we are at a clear point where we're changing chapters and it's a new day. I worked as a nurse back in the early 80s taking care of clients whose condition didn't even have a name. And when I look back over the years of all the researchers that dedicated their time and their expertise, all the advocates, all the people living with HIV, all of the work that's gone on, all of the suffering and loss that's gone on, and now I think, wow, we have the tools and we have a lot of hope. And we just need to move forward into the future in a collaborative way. It's going to take all of us, and it's doable. And that's fantastic. Thanks for asking.
What does an HIV-free Oregon mean to me? For me, it means a happier and healthier Oregon. It means a place with less fear and a lot more hope.